pleasure for me to participate. I mean, I think I agree with several things that were already said. And Jean-Marc, if I would start, from where you start quoting all these studies, I believe that, I mean, that the time, and I wanted to make a few reflections first on foresight and action, some lessons that I think we have learned so far in the EU, but I mean, it's generally, and then a little bit about the future and how sort of foresight or what we might need to do to be able to deal with this type of situations if they are sort of also to occur, I mean, in the future. I think, I mean, generally on foresight and action, I mean, what I would say is that the current crisis is not a failure of foresight. I think it's a failure of preparedness, of preparation, to use a term that Thomas just used. And I think this is, in a sense, I mean, you mentioned several studies. There are several other studies that relate this idea that, I mean, a pandemic was foreseen. I mean, of course, we didn't know when this would happen. But I think the issue here is more an issue of preparedness. And I think probably in the case that we are looking at like COVID-19, I think not only then preparedness, but also I think initially a failure of transparency in terms of how data was communicating and available for us to understand what was happening. And then I think, as the crisis progresses, then there's the issue of competence. Either you are able to deal with it, or either countries are better or are less prepared and competent to deal with it. But I think, I mean, preparedness is, in a sense, what would be the ultimate result of a foresight process. And I think this in the webinar description, you really speak about this link between a foresight process and policymaking. And I think, I mean, in foresight, maybe there are three types of people. I think there's the producers of foresight, people that make the studies, do these things. Then you have the consumers of foresight. But I think there's another element here that we cannot forget, which are the translators. We need to be able to have people, I mean, in public sector, private sector, you name it, that are able to distill insights from, from the wonderful reports that Matt, for example, used to do, that Wendy does, I mean, many others, and try to translate these into concrete policy recommendations, strategies, plans. So this, in a sense, to build preparedness, build resilience. So I think there's a missing link here. And I think no one in the world was able actually to get this right. So I think there's a lot of, there's a lot of work to do. So this, I mean, in a sense, for me, foresight is always a call for action, because if it doesn't lead to preparation, then, I mean, okay, it's intellectually, it's very rewarding, it's very interesting, but I mean, it's not very useful, so to say. I mean, just to put it very bluntly. I think in terms of lessons, I think so far for the EU and looking at how the EU has seen this, I think, I mean, the initial instinct of member states to take care of themselves has been gradually abandoned. But this, I mean, national reaction, I think it's very natural at the beginning, but it highlights that, I mean, if it's not facing a pandemic that the EU is able to unite, then what is? I mean, and so I think this also raises issues in terms of how we think about the organization of the institutions. And here, when I mean EU, I'm mostly speaking actually in this case about the member states, because I think most European Union institutions were out there from the start trying to coordinate. And I think now the level of coordination has increased, tremendously. I mean, I don't know if yesterday you followed this pledging conference that the Commission sort of organized with so many others to raise, almost, about $8 billion dollars for vaccines, for treatment. So I mean, there is, I think, the reverse of this lack of collaboration in the beginning has been, a speed up in terms of collaboration and cooperation. And I mean, again, going back to some of what Thomas mentioned in terms of collaborations, I mean, I think the example that the scientific and medical community are giving around the world in terms of the way that they're collaborating to find a vaccine, to find a treatment to this disease, I think it's outstanding. So I think in that sense, there is a lot of, and there are more lessons to take, as which were mentioned in terms of supply chains. Do we need to rethink, how this is, how global trade is organized, and how we, about how much digital, how much health tech and health, products will become also part of a geopolitical, game. So I think we need to consider some of these aspects. But as we still, facing the crisis, I think it's still very early to be able to take some, some clear lessons from this. But at least, the needs of unity, at least, from a European point of view, and a need for more coordination in terms of, these type of issues, I think it's fundamental. I mean, once we start looking at the future, which, relates immediately with this point that I was saying, for most, I'm no longer a EU official. But I know that me and my colleagues in the past, we're always frustrated when we are asked, so does the EU doesn't do anything, and we have to say, okay, we don't have any competences in this issue. So I think a discussion that EU leaders might need to have in going forward is whether health should become either at least a shared, competency between member states and the EU, because at the moment, it's an exclusive responsibility of member states. Of course, the EU is there to coordinate, to advise, to share, best practices. But in a sense, the Commission does not have the power in health as it has in competition policy or in trade. So it's a different type of thing, and it's maybe a discussion we need to have. A very difficult one, because this might need a rethink, or you need to touch in EU treaties, which is always a very difficult conversation and difficult process. But we need to think about this, because I don't see that there is a way to move from the problem that we have now if we don't have that conversation as well. On the more practical side, also, I think strategic foresight a few years back, everywhere, and I think most people that are around the table would agree with this. Even mentioning the word foresight, people would look at you and say, okay, what, you have the crystal ball, so you're going to see the future? No. I think now it's much more concrete, and I think several crises also led the EU to be much better and to scale up its operation in terms of strategic foresight, to the point that now, since this new Commission, there is a vice president for foresight. So strategic foresight was even elevated to the political level. And I think now what needs to happen at this level is that I think in my proposal, and I've made this proposal since 2016, is a reorganization on how this system works within the EU, because all the potential is there, all the capabilities are there, but I think there might need to be an institutional design issue either within the Commission or with already existing structures that bring together all EU institutions, such as the European Strategy and Policy Analysis System, which is a collaboration of EU institutions on strategic foresight and global trends, which Matt Burrows also contributed a lot to the start of this project. So there are capabilities there already that need to be used or can be used to actually continue to upgrade, the strategic futures and planning at the EU level, so that we can do some of the things that, that Thomas was speaking, that also, Brigadier Droz was also mentioning in terms of how we deal with this. To finalize, I think, there is in all of this, in going forward, and that's an issue which I didn't think that we have discussed yet. I think this crisis and this pandemic creates a different problem. It's a new thing for all of us, but I think the issue, it has to do, the previous crisis in Europe, the financial economic crisis, of course, had terrible consequences from the economic and social point of view. But this one is about life and death. And so I think if it was very easy to ask people, those that can actually stay at home, to go home, I think it's going to, I don't yet understand how people will leave their houses. I don't know how much the element of fear, which is, the reverse side, the element of trust, so I think this trust, commodity in society will be key for us to be able to get out of this crisis. And I think this will only happen with honest leadership. I think this is an issue of leadership, of competence, on trying to address, this crisis, but also of speaking, openly and honestly with citizens. Because otherwise, I think I haven't seen any studies. I was curious to see if any of you have seen studies recently on trust, since the pandemic started. Because I think, it's almost inevitable that people will be fearful now, and there's been a failure in some systems. So I would be interesting to understand how people will feel comfortable going back to whatever normal it is. And I think if we don't do it with everybody together, I think this will be very hard. I'm hopeful that if we don't have a false start now with the confinement and the reopening, I think this is possible. And I think then let's use this moment to take the right lessons and to upgrade our systems to make sure that they are much better sort of adapted to this. And then finally, let's focus on the translators. Let's focus on the people that can actually, are able to tell leaders and decision makers, these are some of the things that you need to do in light of these, futures or these things that we might be faced in the future. It's not easy, but it's doable. Thank you very much.